Mental health stigma is a significant challenge in the South Asian community. Stigma causes delays in seeking help, leads to poorer treatment outcomes and a higher risk of isolation, job loss, and even suicide. The impact is often heightened within the South Asian diaspora. Let's break down the 3 types of stigma I learned about during the conference. So, I just returned from an incredible conference led by Dr. Jerome Carson and PhD student Ashit Shahama at the University of Bolton in the United Kingdom. It focused on mental health within the South Asian diaspora with insights from some of the top minds in the field. So let's dive into the biggest lessons from the event. And if you're interested in the full session, check out the link in the description below.
Because one of the big challenges for today that we've been talking about is stigma. There have been so many anti-stigma campaigns and stigma hasn't gone away. Why? For the simple reason that stigma is about creating the other. It's the othering. And when we do the othering, it kind of identifies our identity. So how I see you seeing me seeing you, it kind of gives that degree of identity and validation of who I am.
So to start, let's break down the 3 types of stigma I learned about during the conference. So there's public stigma, or society's negative judgments, like the idea that mental health issues make someone unfit for marriage. Self-stigma, where people internalize these harmful ideas and feel unworthy themselves. And structural stigma, where laws and policies subtly discriminate, creating barriers to care and support. So together they form a powerful cycle that affects not just individuals, but entire families and communities. What are the consequences? Dr. Hussain, a distinguished professor of mental health at the University of Manchester, highlighted the impact.
I've worked for many years now since the early intervention services and psychosis started. And most of those years, about 14 years, have been in Blackburn. And in those 14 years, I worked with a number of South Asian families. Rates of suicide are high in psychosis. It's probably second to depression. And 80 to 85% of the suicides occur in the first 5 years. That's why early intervention, early treatment is hugely important.
Stigma causes delays in seeking help, leads to poorer treatment outcomes and a higher risk of isolation, job loss, and even suicide. The impact is often heightened within the South Asian diaspora. How does stigma show up in different South Asian countries? In Sri Lanka, mental health stigma affects not only individuals, but their families as well, with fears of how disclosure might impact social status. Supernatural beliefs around mental illness are common, and traditional healers are often sought before medical professionals.
One of the issues that we always say is the close-knit community Sri Lanka is being. So the family stigma, they not only stigmatize the person who has the mental illness, it's also the entire family, or people who are connected to the family. So this is why my parents thought, if I study psychology, I can't get married and my brother can't. So it goes beyond. And then what they do, so there is a lot of shame and fear associated to the concept of mental health. It massively affects social life. So what we do in most of the, particularly if you go to the outskirts from the central cities, what you say, if you have somebody with a mental illness within the family, you hide that very carefully. And you hide it because you want, let's say if that's a child, you want the rest of the children getting married, rest of the children getting jobs, etc., and not being isolated within the community. And community is a very strong concept, and family being part of the community is very strong in Sri Lanka. So it's very important that you can be within that community without that prejudice about a mental illness.
In Pakistan, there's a strong association between mental health and supernatural forces, with mental illness viewed as a personal failing or weakness.
So many people attribute mental health issues to spiritual and supernatural causes such as possession, witchcraft, and black magic. With a low literacy background, most of the people seek help from the faith or religious leaders, and the common treatment methods include spiritually treated water, burning incense, and reciting mantra, etc. Like a mother of an adult who presented with the symptoms of schizophrenia said, "A child is experiencing these symptoms because he is being possessed by supernatural powers, which is called jinn. Previously, she took him to many quack religious healers, babas and peers who used abusive methods, and they are really very strange kind of abusive methods which they use. They beat them, they chain them, and they can do any kind of the thing which is being possibly not imagined by us. And they took a lot of money from him. He came to the psychiatric facility when he was unable to handle her extremely abusive behavior. So generally, coming for the psychiatric help is, you can say, the last resort when you feel that all other methods has been failed.
Men especially are taught not to show vulnerability, creating a culture where even discussing mental health is seen as a taboo.
We have been taught as men to, display our masculinity through aggression and stoicism, just to name a couple here, but these seem to be some of the recurring themes here in terms of masculinity and emotional expression. Furthermore, we are focused a lot on achieving material success and maintaining restricted emotional behavior. And really how we embody this is through strength, and we name this strength. And a lot of times that's a focus on physical strength, emotional strength, and financial strength. Men are also seen as the primary providers for their families, and so they adhere to this role. But the emphasis on strength also comes with this expectation of emotional stoicism and vulnerability as weakness. And so vulnerability is often viewed that way. So many men suppress the emotions and avoid seeking help, creating barriers to their mental well-being. This suppression can have significant emotional consequences. Many South Asian men are disconnected from their emotions, which affects their ability to empathize with others, including their children. So think about the emotionally distant father. That can result in intergenerational patterns, really maybe stunt emotional development and emotional intelligence. And these feelings of closeness and vulnerability are sometimes absent. And the second way that is created is that men do not express their feelings, and in turn do not foster emotional expression in their families. We also see this suppression come out as anger and harming behaviors, often in the form of violence, substance use, and stress-related health issues.
But with therapy, community support, and a willingness to open up, it's possible to break the cycle. Interestingly, women in South Asia are often more open to seeking help, but they face their own set of challenges. In particular, British South Asian women are at higher risk of postnatal depression, but often avoid seeking help due to stigma. For women, mental health issues can impact marriage prospects for them and even their families. And stigma isn't limited to the general public. It affects those in the healthcare field too. Over 80% of medical students with mental health issues reported feeling unsupported by their institutions, and healthcare professionals themselves often lack mental health support.
In 2024, we wouldn't be allowed on a building site without a hard hat. And in most places but yet routinely nurses, doctors, other healthcare professionals are sent into an environment with the knowledge that you will come across morbidity, mortality, death, distress, stress on a daily basis. And there's no equivalent of that hard hat. That assumption is that somehow you'll stumble through. And that kind of remains the model in 2024, even as new medical schools come up, new schools of other healthcare professions come up. The investment has often been around, we'll teach you some resilience, or we'll add on some yoga classes or Pilates classes or something like that. But the actual thinking around how we provide the safe psychological spaces for people to think about how do we individualize and tailor that support to individuals so that they can actually look after themselves on a daily basis, where, there's literature emerging now about the impact of patient death on healthcare professionals, about patient suicides, particularly in my line of work, or on the rare occasion, thankfully, where some of my patients might have been engaged in violence or even homicidal acts. And so for me, I think that there's a lot to be done around how do we focus on prevention and preventing illness in the first place in healthcare professionals.
So, what's the way forward? Conference speakers shared some powerful strategies. One is the need for culturally sensitive therapy that supports South Asian values. Another is increased public awareness through campaigns like Pakistan Hamraz Hotline 1166 and integrating mental health education into schools. Films and creative media are also being used to discuss mental health in a way that resonates without alienating audiences. And one of my favorite approaches, peer support. Being able to talk with someone who understands can be life-changing. Initiatives like the Bolton Speaking Lounge in the UK are creating spaces where people can connect without judgment. So to wrap it up, mental health stigma is a significant challenge in the South Asian community, but more people are taking it on with real solutions. From storytelling and community support to redefining masculinity, we're making progress. So if you or someone you know is struggling, remember, you're not alone. There are resources out there.